Wow, I am a mother of three children. I had beautiful births. I love being a woman. I love being in my body. And I know this is a privilege. I know there are people who may not have the same feeling. And I understand that. And because of this understanding, I have become a birth worker. I've been a birth worker for a very long time. And I just love working with women, or people with wombs, right? I love to work with the unwellness, the traumas, the discomforts that come up with our reproductive system. And I'm also thinking about how, there's some serious irresponsible practices irresponsible practices around gynecology and around birth work. I wouldn't say birth work in the sense of holistic birth work, but more like OBGYN work, where we have lots of questions, and some of those are, why do we have such a high, especially in African communities or African American communities, a high mortality rate of children, of our babies? So I think it comes upon us that we've got to think about, preparing, and how our own unwellness in connection with our bodies and with how we feel and are participating in society could be a part of that. Our accessibility to good foods and nutrition could be a part of that. But also just healthcare, accessibility to good information around ourselves, our bodies, and just the facilities that we trust. We're supposed to trust in our birthing of our children. So I ask us to, all of us, doesn't matter what gender you are, to start to invest more in the knowledge of maternal and child health care. We want to see more of our babies healthy. We want to have healthier pregnancies. And plants, if you study plants, you will see, particularly plants that deal with reproductive system, you will find that plants work very well with our bodies, especially with our reproductive system. There is this gentle yet effective relationship or synergy with plant medicines and our reproductive system. And I say this as a mother, and I say this as a birth doula, I say this as a clinical herbalist. I have seen amazing results with women who've had dysmenorrhea, women who've had cramping, women who are in the middle of birthing and, maybe it's taking a little longer and I've got a tincture and I give them a tincture and they have the baby. So there's so many ways that our plant medicines respond to our issues and conditions and situations around our reproductive health. So I want to invest more teachings around maternal and child care. Children are our future. We want to birth children. We want to have an experience of birthing of our children for the sake of our children's good mental health and wellness. So start to seek out more information around that. And, you can reach me also at olawellofwisdom@gmail.com, or you can go to my website at wellofindigenouswisdom.com. If you have any questions, you can also follow me on Instagram at Ask Ola Clinician. I'm also at Well of Indigenous Wisdom School. And we can discuss more. If there's something more personal, we can discuss more around maternal and child health care.